This Week in Healthcare was another reminder that healthcare costs are not rising because of one simple problem. They're rising because the entire machine keeps getting bigger, more
Uh?
complicated, and more expensive. First story, US healthcare spending hit 5.7 trillion with a T in 2025, and CMS projects we're heading towards nearly 9 trillion by 2034. Now, the important part of this isn't only about prices just going up. A big driver is that we're using actually more healthcare, more hospital services, more prescription drugs, more expensive treatments, GLP-1s. Medicare pressure is going up as Americans get older, and there's just more demand across the system. So when politicians say we're going to lower healthcare costs, that sounds great, sounds fantastic, but this is not a simple leaky faucet. This is a very large, very expensive building with faucets on in every single room. Second story, the White House says employer sponsored health insurance premiums could drop if certain anti competitive hospital contracts were banned. This is a little wonky now, but stay with me. Hospital systems use contract terms that make it harder for insurance companies to steer patients towards lower cost facilities. In plain English, a hospital system can sometimes say to the insurance company, you can have our main hospital in network, but only if you take all our other facilities under our terms and at our prices. This can limit competition, and when competition is limited, costs usually don't go down. The White House estimates that premiums could drop around 6.5% in affected markets. For employers and employees, that's some real money there. But this is the nonpartisan truth. Both parties talk about lowering costs, but the real cost control means powerful interests need to be challenged. We need to take on the hospitals, the insurance companies, the drug companies, and sometimes even the rules our own government has put in place. Third story, the No Surprises Act. Now, if you thought the last one was wonky, we're about to get real wonky. So, the No Surprises Act was designed to protect patients against getting billed out of network charges at in network facilities. So, if you've ever had a surgery and you go to the right in network hospital, the surgeon is in network, all the nurses are in network, all the things are covered, and then in walks an anesthesiologist that's out of network and they hit with a big fat bill. That's the No Surprises Act that what they tried to eliminate, and they've been very successful in doing that. So when that happens, the fight then goes to the insurance company and the provider. They both make an argument as to why they should be reimbursed these different things, and an independent board through the CMS looks at it and awards judgments. Now, the insurance companies have been very upset because a massive amount of the judgments have been found in favor of the hospital, meaning the insurance companies paying out a lot more than they think they should. This is leading to upward pressure on premiums. So we solved the problem at the patient level, but now the system's just fighting with each other in the back rooms, and eventually all these fights show up in one place only, higher premiums. The theme this week is simple. Healthcare costs are not one problem. They are hospital contracts. They're drug prices, aging demographics, utilization, provider shortages, insurer negotiations, and a whole lot of finger pointing all over the place. That's why healthcare policy should not be a team sport. Because while Washington argues over who gets the talking point, employers and families are the ones getting the invoice. And that invoice is now 5.7 trillion. That's here in case you missed it. See you next week.